It just drives home the fact that so much of what we count on and so much of what we're used to having just work is under threat.
Totals of more than 1,000 daily COVID-19 cases has become the new normal in Alberta, and increased hospitalizations have caused a negative ripple effect throughout the entire healthcare system.
Those who are trying to seek non-COVID medical attention are left with cancellations and longer wait times.
3 weeks ago, Beth found a lump in her breast. Her doctor told her she needed to book a mammogram as soon as she could, so she called that same day. A day before her appointment, she was notified that it was canceled.
You're not going to know what's happening in your body. And then they tell you that the wait is much longer because people are, texts and things are just not available. So now not only did I have to wait the first 3 weeks, right? You have to wait another 3 weeks or a month.
Beth took action, calling many clinics and jumped on the first cancellation. She received her mammogram on Friday.
I was lucky that I had virtually unlimited time to call, that I have a vehicle and could drive anywhere in the province basically to get in, right? And not everyone has those. If you could only do something after work, or if you could only do something that was transit accessible or any of those things, I would imagine you'd be waiting quite a bit longer.
Alberta Health Services says they are delaying non-urgent surgeries as the surge in cases has put increased strains on hospital resources. They add that this will help free up space in hospitals for patients who need a higher level of care.
Beth will receive her results on Tuesday. And although her doctor told her to schedule a mammogram as soon as she could, her doctor did reassure her that the lump is probably nothing. But for many others in similar situations, the outcome could be worse.
It's that piece of uncertainty, right? If I get in a car accident, is there going to be an ICU bed for me? We've never had to worry about that stuff before.
In a statement to City News, the province says, in part, Alberta is not looking at additional measures at this time. The best action Albertans can take to limit the spread of COVID-19 is to be vaccinated. Beth echoes part of that statement.
Maybe a requirement to check in with ourselves and say, when we choose to live in a society, we choose to give up some of our freedoms because our freedoms end when they infringe on another person's freedoms.
In Calgary, Kristy Kilburn, City News.